Thank you for being part of the COVICS study. Because of participants like you, we have learned a lot about COVID-19 vaccine responses in both healthy people and in people with different sorts of immunocompromising conditions. My name is Ghady Haidar, and I'm a transplant infectious diseases doctor here at the University of Pittsburgh and at UPMC. I'm the principal investigator for this study. As a reminder, COVICS is part of a larger research program meant to study how well patients respond to the COVID-19 vaccines. In this research study, we are evaluating whether people who are immunocompromised or have a weak immune system are able to produce an immune response after receiving a COVID-19 vaccine. And we will do this by getting a blood sample from you to measure the levels of antibodies that your body has created after receiving a vaccine. We would like to enroll people who are immunocompromised and compare their immune responses to people who are not immunocompromised. Now, as the COVID-19 vaccine landscape has evolved, many people now qualify for additional vaccine doses. You are already part of the COVICS study, and you may have already received an additional vaccine dose or are planning on receiving another one. So, to allow us to better study the immune response after additional vaccine doses, we would like to collect 25 mLs, or up to 1.5 tablespoons, of blood at approximately 1, 3, 6, and 12 months after your additional vaccine dose. We may also draw an extra 25 ml of blood as a single blood draw as well outside of these time points. Now, this part, though, is completely optional, meaning that you can be part of the larger study without agreeing to give us an extra 25 ml of blood, and you will be able to indicate this on the consent document. These blood draws are in addition to what you've agreed to previously. Otherwise, the objectives of the study are the same. Blood will be stored forever without anyone being able to tell it is yours. We will not use your name when we analyze your data. Instead, we will assign you and your biological samples unique research codes to protect your identity before they are used here at Pitt or shared with others. The research data will be maintained for at least 7 years following closure of this research study. Like we mentioned before, since your participation in this research study is voluntary, you may withdraw at any time, and you do not have to participate in this portion of the study. As with any research study, there may be undesirable events or side effects that are currently unknown, and it is possible that some of these unknown risks could be permanent, serious, or life-threatening. Now, that said, this study is considered low risk because we are only collecting small amounts of blood. The risks to having your blood drawn for the study are the same as when your blood is drawn for any other reasons. To minimize these risks, all procedures will be conducted by a certified medical professional. Study staff will monitor you closely throughout the study for any side effects, and you should report any issues to the study staff immediately. If you have questions or concerns about the study, contact the principal investigator, me, or the research coordinator at the phone numbers listed on the first page of the informed consent you will be given. If you believe the research procedures have caused you injury, immediately contact me, the principal investigator of the study, at 833-475-8215 or email askcovics@upmc.edu. If you have questions about your rights as a study subject, please contact the Human Subjects Protection Advocate at 1-866-212-2668. Thank you.